Most people assume a heart attack announces itself. Crushing chest pain, a numb arm, someone clutching their chest and collapsing, the way it happens in movies. But after the age of 60, a lot of the most dangerous cardiac events don't look like that at all. They build quietly, overnight, while a person is simply asleep. No pain loud enough to wake them. No moment to reach for the phone. Here's what surprises almost everyone the first time I explain it. Those overnight events are rarely caused by anything dramatic. They're triggered by small, completely unremarkable decisions made hours earlier, usually before the lights even went out. I spent over 2 decades in operating rooms, working on hearts that had already failed, and in that time, I watched the same preventable patterns show up again and again in people who had no idea what their evening routine was doing to them. Tonight, I want to walk you through 5 of those patterns and exactly what to do about each one. Stay with me. This might be one of the more useful 10 minutes you spend all year. Your cardiovascular system doesn't switch off when you fall asleep. It changes modes. In a healthy body, blood pressure normally dips overnight, often by somewhere around 10 to 15% compared to daytime levels. Heart rate slows, arteries relax. It's routine maintenance your body has quietly performed your whole life. But past 60, that system gets less forgiving. Arteries stiffen. Blood pressure regulation loses precision. Some of the hormonal signals that used to protect the heart overnight weaken with age. During the day, your cardiovascular system has backup options. It can compensate, adjust, correct course. At night, a lot of that backup is offline. You're essentially running on a skeleton crew. That's a meaningful part of why the early morning hours, roughly midnight to sunrise, carry a disproportionate share of heart attacks and strokes in older adults. Not the middle of a stressful workday, the quiet hours when nobody's watching, but your habits still are, and what happens in those hours is shaped almost entirely by decisions made earlier that evening. Let me ask you something I ask nearly every patient. What time did you eat last night, and what was on the plate? A surprising number of people over 60 tell me dinner happened around 8, 9, sometimes closer to 10 at night. A full plate, then the couch, then bed within the hour. Here's the problem from a cardiac standpoint. Digesting a large meal is metabolically expensive. Blood flow gets redirected to the gut, the heart works harder to keep up, and blood fats called triglycerides climb noticeably in the hours right after eating. Meanwhile, your body is trying to do the opposite thing at the same time, wind down into overnight recovery mode. Digesting a heavy meal and downshifting into rest are competing demands, and for someone with even moderately stiffened arteries, that tug-of-war isn't trivial. Research consistently associates eating close to bedtime with higher nighttime blood pressure and a higher rate of reflux, which can itself mimic or aggravate cardiac symptoms. The fix isn't complicated. Aim to finish your main meal by 6 or 7 in the evening. If a later meal is unavoidable, keep it light, lean protein and vegetables rather than something heavy and fried. Now here's something that catches even careful patients off guard. If you're over 60 and on blood pressure medication, and a large share of people that age are, when you take it may matter almost as much as whether you take it. Blood pressure normally follows a daily rhythm. It rises in the morning, peaks in the afternoon, and eases at night. But a meaningful subset of people with hypertension never get that nighttime dip. Their pressure stays elevated, or even climbs, in the early morning hours. This pattern is sometimes called nocturnal hypertension, and most people have never heard the term. That matters because arteries at 3 a.m. are not braced for a pressure surge the way they are at 3 p.m. An overnight spike is more likely to disturb a vulnerable patch of plaque inside a coronary artery, which is exactly the kind of event that leads to an emergency operating table. If your only dose is in the morning, it may have worn off by the time your body needs it most. So here's the actionable step. Ask your doctor directly whether taking your blood pressure medication in the evening instead of the morning makes sense for you. There's real clinical research, including large chronotherapy trials, suggesting evening dosing may reduce overnight cardiovascular risk for some patients. It's a 2-minute conversation. It is not something to assume either way without your own doctor's input. Now think of someone in your life who snores, a spouse, a parent, maybe you. That loud, irregular sound most families have learned to laugh off or sleep through or joke about at breakfast. I don't treat it as a joke. After years in this field, I treat heavy snoring as a possible warning sign of heart disease until proven otherwise. Sleep apnea is one of the most common conditions I see going undiagnosed in people over 60. Current estimates suggest roughly a quarter to a third of older adults may have some form of it, and the overwhelming majority have never been formally evaluated. Here's what's actually happening during an episode. Breathing pauses, sometimes for 10 seconds, sometimes much longer, occurring possibly dozens of times an hour. Each pause drops blood oxygen. The brain reads that as an emergency and triggers a stress response. Adrenaline releases, heart rate spikes, blood pressure surges, while the rest of the body stays asleep. Night after night, year after year. Do that 30 or 40 times in a single night, and it stops being a minor inconvenience. Research links untreated sleep apnea to a substantially elevated risk of heart attack, a strong association with atrial fibrillation, an irregular heart rhythm that raises stroke risk, and accelerated stiffening of the arterial walls. And because it's all happening during sleep, most people have no idea anything is wrong until a serious event forces the issue. The warning signs go beyond the snoring itself. Watch for morning headaches, feeling exhausted despite a full night's sleep, frequent nighttime urination, waking with a dry mouth, or waking up gasping or choking for air. If several of these sound familiar, especially loud snoring plus witnessed breathing pauses plus daytime exhaustion, that combination is exactly what sleep specialists screen for, and it's worth a conversation with your doctor about a sleep study. Many can now be done at home with a simple monitor, not just in a lab. The treatment most people know, CPAP therapy, isn't glamorous, but the evidence behind it is strong. Consistent use is associated with measurably lower blood pressure, reduced atrial fibrillation risk, and meaningfully lower cardiovascular risk overall. One important caveat, because I want to be straight with you. Not everyone who snores has sleep apnea, and having sleep apnea doesn't guarantee a heart attack. It's a risk factor, a serious one, not a certainty. The only way to know for sure is testing, not guessing. Here's a habit built on genuinely reasonable logic, which is exactly why it's easy to overlook. Many people over 60 deliberately cut back on evening fluids to avoid waking up for the bathroom. Understandable, since getting up at night raises fall risk too. But going to bed, even mildly dehydrated, has a cardiovascular cost. Dehydration thickens the blood, making it flow less easily through vessels. For a younger cardiovascular system, that's a manageable inconvenience. For arteries that are already narrowed or stiffened, it's a different story. Thicker blood moving more slowly through partially blocked arteries, combined with the naturally slower heart rate and stillness of sleep, is part of why early morning hours see a disproportionate share of clot-related events. The fix costs nothing. 1 glass of water, around 8 ounces, before bed, and another on the nightstand for if you wake up thirsty overnight. You don't have to choose between sleeping through the night and protecting your heart. Last one, and it sounds almost too simple to matter. What temperature is your bedroom at night? Too warm, generally above the low 70s Fahrenheit, and your body works all night to shed heat. Blood vessels dilate, heart rate stays elevated, you sweat more, compounding the dehydration issue above, and you spend less time in the deep sleep stages where the heart does its overnight repair work. Too cold, down in the low to mid-60s or below, and the opposite problem shows up. Blood vessels constrict to conserve core heat, which raises blood pressure and forces the heart to pump against more resistance. For someone with existing artery disease or hypertension, that's not a trivial nightly stress. The sweet spot most sleep and cardiology research points to is roughly 65 to 72 degrees Fahrenheit, about 18 to 22 degrees Celsius, a range where blood vessels stay relaxed and sleep stays deep. One thermostat adjustment, meaningful protection, no cost. On their own, these might sound like 5 separate things to worry about. Put together, They're actually a simple blueprint, one evening routine that touches all 5 points without requiring a dramatic lifestyle overhaul. Around 6 to 7 p.m., eat your main meal. Lean protein, vegetables, a moderate portion of carbs if needed. Not a feast, not skipped, just reasonably timed. Around 7 p.m., handle medication and hydration. If you haven't discussed blood pressure medication timing with your doctor, let this be the reminder. 8 to 9 p.m., wind down. A short walk, reading, quiet conversation. Step away from bright screens, since they suppress melatonin and can keep the nervous system more alert than you'd like heading into bed. Around 9 p.m., prepare the bedroom. Adjust the thermostat into that 65 to 72 degree range, set a glass of water on the nightstand. By 10 p.m., in bed. And if you snore, or someone's told you that you stopped breathing overnight, try sleeping on your side rather than your back. Back sleeping can worsen airway obstruction, and side sleeping is a simple, free interim step while you arrange a proper evaluation. None of this is complicated. The real question isn't whether the routine works. The evidence behind each piece is solid. The real question is whether you'll actually follow it. I want to speak plainly for a moment, not as a narrator, but the way I would to a patient. Over the years, I've stood in operating rooms in the middle of the night working on a heart that stopped because of a clot that formed while someone slept. I've talked with families in waiting rooms at dawn who had no idea anything was wrong when they said goodnight just hours earlier. In case after case, the contributing factors weren't exotic. A late dinner, a missed evening dose, a too warm bedroom, quiet dehydration, an airway that had been silently collapsing for years while everyone assumed the snoring was just noise. These aren't rare risk factors. They're the background texture of millions of ordinary evenings. But repeated night after night, year after year, that background can eventually add up to the event nobody saw coming because nobody knew where to look. If there's one lesson 2 decades in that room taught me, it's this. Most of the hearts I worked on didn't fail because of bad luck. They failed because of missing information the person simply never had. You have it now. What matters is what you do with it. Let's bring it together. 5 habits, 5 simple corrections. 1. Finish your main meal by 6 to 7 p.m. 2. Ask your doctor whether evening dosing makes sense for your blood pressure medication. 3. If you snore, wake up exhausted, or have witnessed breathing pauses, get evaluated for sleep apnea. After 60, this isn't optional. It's part of basic cardiac care. 4. Drink a glass of water before bed. Keep one on the nightstand. 5. Keep the bedroom between roughly 65 and 72 degrees. I'd genuinely like to know, which of these sound familiar to you? Most of the people I've talked to over the years recognize at least 2 or 3. The difference now is knowing what to do about it. If this was useful, consider sharing it with someone in your life over 60 who's never connected their evening routine to their heart health, a spouse, a sibling, a friend. And if you'd like more breakdowns like this, subscribing helps. Take care of your heart. It's been working for you every day of your life. Give it what it needs to keep going. Everything shared here is general medical information based on current cardiovascular research, not personalized medical advice, and not a diagnosis. Before changing anything about your medication schedule, especially timing, please talk to your own doctor. Good night, and take care of yourself.